Malaria is the leading cause of illness and death, especially amongst children under the age of 5. The disease is more prevalent in rural areas where access to healthcare is limited. To this end, the Ministry of Health, in collaboration with World Health Organization, Malaria Consortium and others, has organized the Ministerial Roundtable on Rethinking Malaria Elimination in Nigeria. The Coordinating Minister of Health and Social Welfare, Dr. Ali Pate, disclosed 9 steps to shift and key actions the ministry will take to scale up interventions, amongst which are relentless focus to operation excellence, local production, and others.
An advisory on malaria elimination in Nigeria, which is independent, but also combining our external and internal experts anchored around the SWOP that we have had, so that we elevate it at a meta level, so that we go deeper on some of the issues, the optimization, the modeling, building on some of the work that WHO has done. Introduction of vaccine, how we do it in a responsible manner. Yes, we've got an application with Gavi, but other considerations, the fiscal consideration, the operational consideration, how do we build that into our policy and also advise the NITAC, which works with MPHCDA.
The Minister of State for Health and Social Welfare, Dr. Tunji Lausa, in his welcome address says malaria as a part of Nigerian daily lives has consequential effect on our productivity, stating that the disease remains a foremost public health challenge.
About 60% of all hospitals attendance in Nigeria today is due to malaria. The disease contributes about 30% to our childhood mortality. There's hardly any aspect of our daily lives that is not affected by malaria, which has consequential effect on productivity. The disease has indeed remained a foremost public health challenge. Nigeria has witnessed some reduction in the prevalence of malaria since the introduction of some intervention, such as the use of long-lasting insecticide nets and the use of artemisinin-based combination treatment for the treatment of uncomplicated malaria, as well as the introduction of chemopreventive therapy for pregnant women and children between the ages of below the age of 5 years.
Dr. Lausa, who lamented over malaria being a burden in the country, says it's affecting everyone regardless of age. Giving appraisal to the National Strategic Plan from 2014, the Minister of State says the performance so far is unimpressive, expressed the ministry's determination to scale up intervention to eliminate malaria in Nigeria.
We're committed to sustaining this collaboration through which significant resources have been expended and numerous activities aimed at controlling malaria in Nigeria have been undertaken. It is time to change the narrative about malaria in Nigeria and by extension the world. The government of Nigeria is also committed to more domestic resource mobilization in a quest to eliminate malaria from our country.
During the course of the event, the Minister of State for Health and Social Welfare, Dr. Tunji Lausa, anchored the second panel of discussion with stakeholders on how to fast-track malaria elimination. The coordinating minister and Minister of State, in an interview with press, has this to say.
Very fruitful conversation and discussion with development partners and all the leaders in Nigeria in the healthcare sector on our malaria elimination plan. A big part of it is research and development, but before I get into that, it's a multifaceted approach. It's a whole of a government approach. We're involving the Ministry of Environment, the Ministry of Agric, and also Ministry of Education in our agenda to move ahead to eliminating malaria. A big part of it is use of data, and before we use data, we have to do research. There are a lot of we have abundant evidence out there that's already available to us to use on our strategies. on how we can begin to use all the tools available to us, combination of tools on our malaria elimination strategies. So it's an ambitious agenda, but it's been done in several other countries. We believe we can do it. This is the best time in the history of our country. We have a president that is committed, and we have the entire Ministry of Health committed to driving this agenda and actualizing the president, one of the president's multiple agenda, which is ensuring meaningful and comprehensive healthcare delivery to every citizen of Nigeria. We thank our president for providing a fertile environment for this to happen, and it would happen.
Comfort Olayinka, Ecohot TV.